Hi, my name is Solomay Tibabu, and I'm the host of the Behavioral Health Tech Conference. And today we have Dr. Andy Keller, CEO of Meadows Mental Health Policy Institute, joining us. And thank you so much, Andy, for being here. To kick things off, I'd love to ask you a little bit about what is Meadows and what makes your organization unique.
Well, thanks, Solomon. Thanks for letting us be here. It's awesome to be part of this amazing virtual and real event you're putting on, and it's an honor. It's always great to talk to you. So Metas, what are we? So we are, I think technically we're like a think tank who works on policy and program, and we're a nonprofit and largely philanthropically supported and nonpartisan. But I think what we really are is I think we're the only organization in the country that is operating at the intersection of policy and mental health programs at scale. So we're trying to take policy and programs so that everyone in the United States and the world, but probably for now, mostly the United States, can get the mental health care they need when they need it. And we started out in Texas. We're Texas based. But we've grown. We're now we just had our 10th anniversary. So we're officially 10 years old. So we're double digits. And we now have our policy work, our justice work, based in Washington, D.C. So we're really operating at a national level now. And our mission is really to help people in Texas, the nation, and the world get the care that they need. We're very much about helping people get care because we have this terrible mental health crisis, certainly among our youth, but really for everybody. And so that's what we're about.
Fabulous. Thank you. And I'm very familiar with the great work that your entire team does and have been proud to serve as a senior fellow for digital transformation in this past year. And so one thing that I know is that when people hear policy and digital mental health technologies in the same sentence, they're often pretty confused about how or why they even go together. So can you tell our audience a little bit about why Meadows has pursued this intersection, and more specifically, how you came to leading our entire policy track at the Behavioral Health Tech Conference?
Yeah. Well, which is an honor. It's so much fun to collaborate with you. First of all, I think you know everybody, right? Don't you know everybody? I think you do. Anyway, so or everybody who I want to know, and who I've enjoyed getting to know. So the reason why we care about this is it's at the center of our mission. So like we are, as everyone knows, we're in this unprecedented youth mental health crisis that has been going on for a while, got worse after the pandemic. And what's the biggest reason why it takes 10 years from symptoms to care for those lucky enough to get care? It's because of our workforce. And to us, it's not so much that we don't have enough of a workforce, it's that we're misdeployed. We're not in the right places and we're not where people are at. And we're also not in the right population. So the beauty of digital mental health technology is we think, the most important factor for accelerating the closing of that gap. Because what it does is it empowers clinicians to do more. It takes away some of the routinized work, scheduling, linking people, finding people, overcoming geographic distances like the one between you and me right now. That technology is a force multiplier for our workforce. And we need to grow our workforce, we need to support our workforce, but we need to deploy our workforce better and also with better quality, because that's the other cool thing about digital mental health technology is we can embed measurement-based care, precision medicine protocols, AI-enabled supports, so that we operate not just where we need to operate and when, but at the best of our capacities and our skills.
That's an excellent overview, and you were already starting to give a few examples of how some specific ways that tech can help offset the mental health challenges we're facing. But can you dive deep a little more into some of those examples?
Yeah, I think there's several things like that. So one is, let's just kind of start with that one. So matching the provider's expertise to the patient's needs. And empowering patients to make better choices and to have more choices among providers. I mean, the industry's been trying to do that. I mean, I've been working in managed care and with managed care plans since like the mid 90s. And this has always been the trick. Like, how do we deploy technology? And I think part of what always limited us is we were doing it from a central location. And what digital mental health technology does is it puts it in the hands of the person who wants care, or the parent who needs care for their child. And it just empowers people to help us scratch because we can't do it just our own as providers. I think it also helps us deploy screening more effectively. So if you look at organizations like Neuroflow, who have really been able to partner with health systems to do things. I mean, I love AI and they've got cool AI things, but like I love, you know, basic technology, like the basic things like the PHQ-9 is an amazing tool that almost no one has access to. More people now than ever, but still not most people don't, to be able to detect and screen. And we know mental illnesses begin, most of them before teenage years. And so being able to empower pediatricians, healthcare practices to detect and then monitor improvement. It's not just enough to screen. We got to repeat that. And a digital mental health tool makes that all the more effective. And then I think there are specific digital treatment enablers that are able to build on that base infrastructure. But like, just don't underestimate how important it is to do the matching, the reaching, and the measurement-based care component.
Each of these examples could demonstrate the impact that we could make in our space right now. And I know you and I both know that a lot of these solutions even exist now, but what are you seeing as some of the problems with getting these solutions integrated into our systems meaningfully?
Yeah. Well, the biggest one is our system is misdesigned. Like our system, like the mental health system, I mean, I'm a community and clinical psychologist. So, the first thing I read about when I got into grad school was the Community Mental Health Act. Thank you, President Kennedy. And thank you, Patrick Kennedy, for just having an event earlier this fall where we were reminded 60 years ago how powerful that change was. But that was built onto a misdesigned system of state psychiatric hospitals. And we have continued to build the mental health system as if we're separate from the rest of the body, that we can just sort of build the psychiatric component, the brain component, distinct from the rest of healthcare. And that's just wrong. I mean, we can't do this. So like heart disease, we didn't get ahead of by having a whole cardiology care, division separate from healthcare. My heart disease risk has been minimized by my primary care doctor. So really the biggest thing is we must truly use this technology to integrate into primary care. That's the only way we're going to detect. And almost as important as that is being able to partner with schools. One neat thing we've done in Texas is we've been able to ramp up this infrastructure where we now have about 65% of our schools with MOUs and protocols and digital connections to a consortium of our 12 medical schools. And by the end of this year, we'll have all 5.5 million Texas students at the end of this school year with access to same-day, real-time, urgent telehealth care with measurement-based care built into it from our medical schools. The technology was the easy part there. The hard part was the politics of negotiating with 1,200 school districts to negotiate that access, tailor that access to their student populations, build in protocols so parents feel that they're, there with their children and we're not doing things to children that parents aren't a part of, and caregivers. So the infrastructure and then the policies around that, we think, are the biggest impediments to scaling. So there's a lot of cool things right now, but they're being bolted onto a system that is misdesigned and not able to scale. So we need to have policy at the table to redesign, retool, and empower those technologies to reach more people.
Wow, congratulations on that amazing announcement around the schools. My goodness. I'd love to hear, do you have any other examples of how you're bringing your work to life and seeing this vision in practice?
Yeah, I think that another one just kind of in the pediatric space that I to talk about is there's a partnership we're part of called the Path Forward with the American Psychiatric Association, with the JED Foundation, with the National Alliance of Health Purchasing Coalitions, and also with the HR Policy Institute, and then as well as the Goodness Web and the Bowman Family Foundation. So these organizations are really working on the policy issues around integration of care. How do we speed access to integration of care, measurement-based care? And digital mental health technology is so central to that. So when we look at places that are scaling up collaborative care, for example, there's organizations like Concert, Neuroflow, who I'd already mentioned, Bend Health. There's a lot of really neat organizations out there, and probably some that I should mention because they're sponsors. So if you want me to remind me of some, I'm happy to mention them. But there's a lot of cool people out there. I'm just thinking of the people I've talked with in the last week who are doing who are enabling this. And technology is the key to being able to rapidly scale. We got to change the policies. We got to get the financing there and make it better. And things like the Complete Care Act, which is, still there in Congress this year, despite all the challenges facing Congress. And, don't want to jinx it, but it's, those would be things that would really empower from a policy perspective the continued scaling of these solutions. So I think, and I probably the neatest example of that, can I add one more, or do you want to? Okay, there would be, this partnership we have with Gray Matter Capital, because I think folks like Gray Matter, which I'm not sure there is anybody like Gray Matter. I mean, Donish and Andrew are pretty amazing, but folks in the venture space trying to pick the companies that are going to be most transformative, most impactful, and get them the capital they need to grow. They need to pick with an eye towards this policy landscape. And so we launched a partnership earlier this year with Gray Matter, where we have this joint position that we have invested in alongside them to build capacity to look at this policy landscape, so that the companies that are chosen and supported are able to navigate and leverage these policy opportunities, but also, and I think just as importantly, policymakers can see what is getting in the way of innovation, what is getting in the way of successful entrepreneurs who have solutions people need, but they're not able to go to scale because of policy barriers. So it's this two-way policy dialogue, and we're honored to be facilitating that, and we're really excited about what can be unlocked through just learning more about how policy can better support and enable innovation.
Excellent. Another amazing example. And a lot of the organizations, funds that you just mentioned will be joining us at Behavioral Health Tech. And it just further highlights what I've always admired of Meadows is your capability to serve as the bridge between the digital mental health ecosystem and policymakers. So excellent work on that front, on so many fronts. But, Andy, we've covered a lot in just a short period of time here, but is there anything else you want to say or let the audience know as it pertains to bridging this gap between digital mental health and policy?
Yeah, probably maybe just a couple things. One is I really want to help, I really want to thank the Commonwealth Fund for their support of a project we were able to do with you earlier this year, Salome, as a co-author, that looked at near-term policy levers that the executive branch could look at to accelerate adoption of digital mental health technologies. And I think a lot of that, from my perspective, and so as a co-author, please correct me if there's ways you want to say this differently, or if I'm missing a nuance. But to me, what I was so impressed by in that report that you worked on with Casey Kelly and her team here at the Institute was to look at how, there are some things that require FDA approval that are new, novel technologies, and we want those. Those are important to move forward. But a lot of what's happening is really just enabling and empowering practices that we already know work. So they're not novel practices. They're tools to help existing evidence-based practices reach more people. And so that's a really important distinction. And it's one that I think we need to be more explicit about, that there's value in both of those lanes. So I think that's one thing. It's a resource. It's on our website. I'm sure you have distributed it as well. And so folks can look for that. I think the other thing I just want to say in closing is that I think this is a time for optimism and hope and for urgency. We have to close this gap. And it's not a gap to, perfection. Healthcare is not great in general. There's a lot of problems with our healthcare system, with everybody's healthcare systems. There's inequities everywhere, but we're a lot worse right now. And we have to have urgency around that, but we also have to have hope. And I really am excited that in the next few years, if we truly can get care to children, caregivers, families in particular who need it, that we can begin to close this gap and actually start lowering the mortality, and even more so the morbidity, the impact on development, on school performance, on relationships, loneliness, experience, all of that. So I'm excited, Salome, and I'm very big part of my excitement is because of digital mental health technology.
Thanks for that, Andy. I too think that now is absolutely the time for so many of the reasons you mentioned already. and also want to extend my gratitude to the Commonwealth Fund in supporting us in our partnership with that near-term solutions policy paper, which we will again disseminate for anyone who hasn't had a chance to read that. Spoiler alert, we did discuss that some recommendations included that CMS could offer an informational bulletin, even just to clarify existing avenues for where within their organization they can support and adopt digital mental health technologies. We also recommended the FDA, ONC, SAMHSA partnering to define more precise categories and definitions around digital mental health technologies to support regulatory pathways. And then finally, ONC suggesting that they develop data security, interoperability, and privacy standards to help digital mental health innovators better develop solutions that are safe, effective for all. And I believe that was just the beginning. We had a great appetite from the policymakers we connected with, as well as the digital mental health community.
Well, it's a cool roadmap, and I loved how you guys thought through that sort of alphabet soup of all the agencies that need to work together, because they do. And I think it's interesting too, because SAMHSA is in a very different position than they were pre-pandemic. They have like more than 3 times the funding, and I think even more importantly, I mean, they have great leadership right now, but I think more importantly than the funding, they now have the opportunity to take things to scale. I mean, SAMHSA pre-pandemic was doing cool grants to make things better. Now I think there's a vision there of we have a nation, then the Surgeon General's weighed in on this, that needs us in the mental health world, you, me, all of us listening, to step up and do more. And I think SAMHSA's ability to sort of step past some of the boundaries that have stopped it before, because it, didn't have the resources, didn't have the scope. And the scope isn't going to go from just SAMHSA, it's going to go from the partnerships you guys mapped out there. So I thought I really appreciate that. There's more to do, but I thought that was a great set of sort of, as you wrote in the paper, next steps, near-term steps that could be taken. So thank you for that.
Thanks so much. And yes, again, I will post it. And it was a great first step suggestion for not only the agencies we mentioned, but also our audience. And again, so grateful that the Meadows team could come and convene us in this policy track at the conference. And thank you, as always, Andy, for sharing your time and expertise with us. Really appreciate it.
Well, it's an honor. So, I mean, one of the things that's another part of our mission is we want to be the best partners we can be to help others who folks need to hear from to be out there. And you are one of our favorite partners. And I just thank you for the conference. Thank you. Thanks for doing it in person. And I'm so bummed I'm not there, but you totally got am I too old to say FOMO, or is that a thing? Do people say that? Like, I'm totally missing out and upset. I have UOMO, upsetness over missing out of your wonderful time. So next year, I want to be there.
Next year for sure. Exactly. Right. Thanks, Andy.
Thanks, Take care. Good luck.